This is the upper limb tension test for median nerve. To begin the test, instruct the patient how to laterally flex their head properly without rotation. This will be our sensitizing maneuver during the test. Bring the patient's arm into abduction at 90 degrees. Block the shoulder with your forearm. Position the patient's fingers into extension with the hand in neutral and therapist's elbow pointed towards the ceiling. Supinate the wrist and bring the wrist into extension. Monitor the symptoms throughout the test. Maintain arm into 10 degrees of horizontal adduction. Bring shoulder into external rotation and ask about the symptoms. Move into elbow extension and ask about symptoms. Have the patient tilt their head towards you. Ask the patient what this does to their symptoms. A typical response would be a decrease in the patient's symptoms due to desensitizing of the median nerve. Bring the head back to neutral and tilt away from the therapist. Ask about the symptoms. A typical response would be an increase in the patient's symptoms due to sensitizing the median nerve. This was the upper limb tension test for the median nerve. This is the Phalen's test for carpal tunnel syndrome. The patient positions both of their wrists in flexion so that the dorsal sides are touching. A positive test would be that the patient experiences numbness or tingling within 45 seconds in the median nerve distribution of the first 3 digits in the palm. This was the Phalen's test for carpal tunnel syndrome. This is the Tunnell's test for carpal tunnel syndrome. The patient will rest their hand with the palm facing up. Tap the area over the median nerve between the flexor tendons of the wrist. A positive test is tingling in the median nerve distribution of the hand. This was the Tunnell's test for carpal tunnel syndrome.